So today I have Miss Gardner here. She's here to establish care at our clinic. So we are going to do a abdominal and musculoskeletal focus exam on her. So I'll start by washing my hands, introducing myself to the patient, and pulling the curtain for privacy. So we're going to go ahead and start the abdomen assessment. So I'll have the patient lie back, and then a normal exam, patient would be dressed in a gown, and I would be able to see her bare skin. But today we're going to do it this way. So first we're going to start by inspecting the abdomen. We're looking for the color of the skin, the size, the symmetry, the contour of the belly, is it round or flat, and then any wounds or masses. And to look for that, I'm going to have the patient lift her head up, and when her muscles are contracted, we're looking for any hernias or separation of the muscles or masses there as well. We're looking at the umbilicus. Is it symmetrical? Is it inverted or protruded? And then we're going to start with auscultation, which is the next step of abdomen exam. So we're going to notice the 4 quadrants, and we're going to start on the right quadrant of the abdomen, listening for bowel sounds with the diaphragm of the stethoscope on the bare skin. So we're going to move in a clockwise fashion. We should hear irregular sounds, 5 to 35 sounds a minute. And if you don't hear any bowel sounds, then you want to listen for 5 minutes in each quadrant to be able to confirm no bowel sounds. Also, while we're auscultating, we want to go ahead and auscultate for any friction rubs in the liver or the spleen. So we're going to do that using the diaphragm of the stethoscope. So the liver in the right upper quadrant here, listening for any friction rubs, and then the spleen in the left upper quadrant. And there should not be any friction rubs. Also, we'll go ahead and listen for our vessels, our major vessels. Here we're going to listen to the aortic vessel right under the xiphoid process. Then the renal arteries to the right and left of the umbilicus. And then the iliac arteries to the right and to the left. And then also in a normal exam, we would listen to femoral arteries to the right and to the left. And again, this would be on bare skin. We shouldn't hear any breweries when we're listening there. So next, we're going to start our percussion. So we'll start in the right upper quadrant. We're going to percuss clockwise again. As we're percussing, we should hear tympanic sounds over the air-filled organs like the stomach and the intestine, and then we should hear dullness over the solid organs like our liver and the spleen. So as we have finished our percussion, we want to outline our liver border. So I'm going to start on the right lower quadrant and percuss. We should hear tympanic noise, and then when it changes over to dullness, we want to mark that spot there. So we're marking there, and then from the mark we want to percuss upward till we hear tympanic noise. And there we're going to mark again, and the distance between those 2 markings would outline the liver, and it should be 6 to 12 centimeters for a normal sized liver. Also, we want to palpate over the spleen, and it should be dull. We're going to also palpate over the epigastric region here, listening for tympanic noises that would indicate gastric air bubbles. So also, we are going to go into palpation. We're going to start in the right upper quadrant. We're just going to start with light palpation, just to feel the area. Should be soft and non-tender. And then we'll go into deep palpation. We're just feeling for any tenderness here, deeply. And then we want to palpate our liver and our spleen here. So what we're going to do is I'm going to place my hand underneath the patient, where on the, like, underneath the right upper quadrant, and then I'm going to put the finger pads of my hand here, feeling for the rib, 12th rib, and then I'll have the patient take a deep breath, and I'm going to push my hand up towards her head, and as she exhales, I should be able to feel the liver. And then I would do that on the left side as well. Place my hand underneath the patient, using the finger pads of my hand as the patient inhales. I'm gonna push my fingers towards her head and underneath the rib, feeling for the spleen. The spleen, though, should not be palpable in a normal exam. Next, I'm going to feel for, palpate for the kidneys. So I'm putting my left hand under the flank here, and then my right hand over the costovertebral angle right here, pressing up on the end that's underneath her back and down. As she takes a deep breath, I should feel, as she exhales, I should feel the kidneys slide in between the fingers. Majority of the time the kidneys are not palpable. Often the left side will not be as nearly as palpable as the right. We also want to look at the umbilicus, and we're going to palpate around the umbilical ring, just feeling for any nodules or nodes, pain or tenderness on palpation. And then we also want to note here any aortic pulsations that you might have. You can look and inspect the pulsation, but you can also palpate the aorta. So I'm going to take my hand right underneath the xiphoid process in between the right and left costovertebral angle, and I'm basically just going to like cup it and feel for a pulsation, and you should be able to notice the pulse there. So now I'll have you sit up. We're going to percuss your kidneys. We're going to percuss the kidneys to find out if there's any tenderness. So I'm going to go on the right costovertebral angle to the right of the spine, using the ulnar surface of my hand. I'm going to tap my hand lightly, any tenderness, and then on the left costovertebral angle, doing the same thing. No tenderness there. If there was tenderness on percussion, then I would assume that the patient had something, some kind of kidney infection going on. So now we're going to move to the musculoskeletal exam. I'll have the patient stand up real quick. I'll have to take a few steps towards the door over there and then come back towards me. As she's doing this, we're noticing her posture, symmetry, the curvature of her back. We also want to notice the muscles. As we're looking through the whole exam, we want to notice muscles for their size and their symmetry. Is there any fasciculations or muscle spasms? And we notice that she has symmetrical shoulders. Let's just go ahead and, well, actually, that's it. You can have to say. We're going to go ahead and just inspect anteriorly and posteriorly as we're doing this. We're going to start with the temporomandibular joint. I'll place my fingers on the right and left here. I'm going to have the patient open and close, and right and left, and then out and in, and then clench, and don't let me move. Very good. That's testing the masseter and temporal muscles, the clenching. But when you're palpating the tibiomandibular joint, you're feeling for any tenderness. There shouldn't be pain and there should not be crepitus. Clicking is often normal. Moving on, we're going to inspect the neck and the shoulders here. We're looking for discoloration, symmetry of the neck. We also want to palpate. We're going to palpate the sternocleidomastoid muscle, the acromion process here. We're going to go back into the scapulae, over to the greater tubercle of the humerus, and the bicep groove here. We're noticed on palpation. So we do that on the right and the left if this were a normal exam. We also want to palpate the neck. So I'll have the patient put your neck down. Yeah. We're inspecting the neck, looking for symmetry, and we'll start with palpation of the cervical spine down to the paravertebral, over to the scapulae, and then we also want to palpate the trapezius muscles, as we were doing that. We're noticing, or we're looking for any pain that she might have crepitus, anything abnormal there. And as we're posteriorly looking at her back, we're going to go ahead and palpate and inspect her thoracic spine all the way down to her iliac crest. So we're looking and palpating down the thoracic spine all the way down to the iliac crest, and then we're going to go paravertebrally down her spine, just palpating, and then palpating the iliac crest as well. And then we're going to percuss. So I'm just going to percuss over each spinal process all the way down the back, and then percussing over the paravertebral to the iliac spine, or the iliac crest, excuse me. So there should be no pain or tenderness on percussion or palpation there. Another thing that we want to do is assessing the range of motion of the neck. So I'll have the patient do chin to chest, and then chin up to the air, and then I'm going to go to the right and the left, and then we're going to rotate from left to right as well. And there should be no pain. That should be a normal range of motion. So I'll have you stand up now, and we're going to test the flexion and extension and assess her thoracic spine. So if you'll turn to the side, I'll have you bend over and touch your toes. And as she's standing, we should notice the reversal of the curvature of her back. And it is symmetrical. And then stand to the front. And I'll have you lean to the right and then to the left. And there should be like a 35-degree angle laterally, testing her lateral extension there. So you can have a seat here. So now we're going to move on down to the elbows. So we're also, as we do this whole assessment, making sure that we're testing both sides. So now we're assessing the elbow, looking for the normal angle, symmetry. So here we're feeling the elbow, we're feeling the ulna, the olecranon process, the medial epicondyle, and then the lateral epicondyle here, and there should be no pain, no crepitus. We also want to test elbow strength when we're doing this as well. So I'll have you lift your hand to your shoulder and then extend it all the way. And then we want to test your strength here, so I don't want you to, don't let me pull your arm. Very good. And we're going to test that on the left side as well. Moving down, we're looking at the wrist and the hands. So we want to look at the palmar side and the dorsal side. We're just inspecting at first, looking at the number of fingers. Is it symmetrical with the other hand? The color. We want to palpate each joint, each finger, for any crepitus or pain on the fingers here, palpating across the knuckles, and palpating also in the wrist, and no pain there. So we want to test for flexion and extension of the wrist. So flexion and extension of the wrist there, pronate and supinate. And then also we're going to test for the strength of the wrist. So with flexion, I don't want you to let me pull you away. And then extension, don't let me pull you. Very good. We would do that to the left side as well. And now we want to test the strength of the hands. So I'm gonna have you make a fist, and then squeeze my hand. And let's also test flexion, extension of your fingers. So flexion and extension, and then abduction and adduction. We're also going to do the wrist, internal rotation and external rotation. And that should all be normal. There should be normal range of motion with no pain. Okay, so lay back down for me. We're going to inspect the hips. Upon inspection, we should notice the size. Are they symmetrical? Are they in line with one another? And then we're going to palpate for any crepitus or pain in the hips. Then I'll have the patient lift the right leg up for extension, lift it straight, and then you can rest. I'll have you move it out to the side for abduction, across your leg for adduction. Then I'll have you bring your knee to your chest here. Should be about 120 degrees there. And then take your knee and try to put it over your other leg. Very good. Adduction. And then let it rest. And that's for abduction. So she's got normal range of movement in the hips on the right side. We would also want to test the left side. Okay, you can put that down. Okay. So before we test her feet and knees, I forgot to test the range of motion of her shoulders. So we're gonna do that very quickly. I'm gonna have you extend your arms all the way up to the ceiling for flexion. We're going to extend them back behind you for extension, and then across your chest for adduction. And abduction is just hold it out to the side, so you can't see her. Hold it out to the side. In external rotation or internal rotation, arms behind your back, and external rotation, arms behind your head. And that was a normal exam there. Now we're going to look at our knees. We're again going to test the right and the left, but right now we're just looking at the right. We're looking at the tibiofemoral joint and palpating there, as well as the tibial tuberosity. And we're also going to feel behind the knee at the popliteal space, feeling for any swelling or pain upon palpation. While she's sitting, I'm going to go ahead and look at her feet and inspect her feet. So we're looking at the bottom of her feet for any wounds, the number of toes here. We want to palpate and feel all of the phalanges for any pain or tenderness there. We're also going to palpate just the top of the foot, the lateral and medial malleolus, and then as well as the Achilles tendon behind the back of the foot here. For any pain or tenderness, normal range of motion. Point your toes down, flexion, extension, spread your toes apart for me, can squeeze them together. And then as she stands up, we're gonna look at the strength of her knees. I want you to turn this on, sorry. I want you to bend your knee up to the back and extend it out straight. And then bend it back again, and I don't want you to let me push it down. Very good. And extend it forward, and don't let me push it down. So she got good strength of the knees. And then I want you to walk, and we need to look at the way the patient is walking and how she's bearing weight. She should be bearing weight midline. We need to look at the angle of her foot. And then have a seat one more time for me, sorry. And I need you to push down like you're driving a car and pull back, testing for her ankle strength as well. And this should be the end of the exam. So I would ask the patient if she had any questions. I would wash my hands, and that would be the extent of our exam.